Hi, Red Berets, Medicare for All. This is Laura Fielding, Executive Director of Red Berets Medicare for All and Whole Washington Board member. Today is episode 11, and I'm going to do this live stream first and foremost for myself. Sometimes it's difficult for me to focus. Like I was just sitting there knitting and listening to an interview that's on wholewashington.org that is run by Cindy Black, who is one of the Whole Washington Health Trust policy writers. And so she's also on the board of Whole Washington. So I was very thankful to be invited to onto Vanguard podcast the other night, and I feel that it went well. I said a lot. That's just something we need to work on, all of us probably, right? Or some of us. It probably happens when you're unsure of what you want to say. That's what I'm thinking. And so anyway, what I want to do is walk myself through the Whole Washington website and read aloud exactly many details here. So I don't know how long that I will go on until I kind of need to take a break. But like I said, I'm particularly going to do this live stream for my own benefit so that as I knit, I can just listen to this over and over again so that I can learn the policy. I'm somebody who is going to have to listen to policy details. It's like the harder that I try to focus in and read something or listen to something, it's almost like it doesn't go in that way. I feel like I've heard a lot of these things before, and yet if asked this information in an interview, I won't be able to repeat it. I think if I work hard enough, I can change that. So that's what I'm doing. So as I go to navigate the Whole Washington .org website, the first thing that I come to on the menu, the top bar is information. So I'll click on that. What is it? Is the first question that I've clicked on. So I'm just going to read aloud and then I can listen to this over and over again. And for all of your general benefit, Whole Washington, you'll see some of my previous videos for the benefits of becoming part of the Whole Washington community of organizers, because we are not solely focused on state level efforts. We're also working alongside other states on a one-payer state strategy. And we've been very heavily involved in helping to organize in support of both of the federal bills, the Senate and the House bill. Okay, so the Whole Washington Health Trust would be the first statewide publicly financed not-for-profit healthcare system in the U.S. Instead of private insurance companies and multiple programs, one government-guaranteed trust would pay the healthcare expenses of Washington state residents. This bill was written by citizens, for citizens, free from the influence of corporate and special interests. The ultimate and urgent goal is comprehensive health care from cradle to grave, delivered to all. Fantastic. Back to the information tab. Below that, below what is it, is who's covered. All residents of the state of Washington are covered. The unemployed are covered. The homeless are covered. Those traveling temporarily out of the state are covered. Those living here for a temporary job are covered. And to make sure it's in writing, no person shall, on the basis of race, color, national origin, age, disability, or sex, including sex stereotyping, gender identity, sexual orientation, and pregnancy, and related medical conditions, be excluded from participation in, be denied the benefits of, or be subjected to discrimination by any participating provider or any entity conducting, administering, or funding a health program or activity, including contracts of insurance under this chapter. And then it cites Senate Bill 5204, full text. I may get around to reading the full text of SB 5204. And now under that is what's included. The whole Washington Health Trust is a single and comprehensive benefits package. It considers the following essential: inpatient, outpatient care, 24-hour emergency services, prescription drugs, medical devices and biological products, mental health and substance abuse treatment, reproductive care, maternity, newborn, pediatric care, rehabilitative care, occupational and physical therapy, palliative and the end, am I saying that right? And the end of life care, dental, audiology, vision, acupuncture, some massage, and other healing therapies. And then it cites the section within 5204 that you can click on if you wanted to look further into the specifics. There's that again. So how do we pay for it? So all of these that I'm going to read, there's a link where we can click each individual one and gather the very specific details. But I'll read the overview first. So how do we pay for it? Employer payroll contribution, employee payroll deduction, self-employment contribution, monthly premium, investment profit contribution. All right, so let's go to employer payroll contribution. Employers will collect a contribution for each employee. After an exemption, the employer payroll contribution is a total of 10.5% of gross pay. Employers are able to deduct up to 2% from the employee's wages. See employee payroll deduction. If the employer deducts 2% from employees' wages, the employer's contribution would be 8.5%. Or employers may choose to pay the employees 2% contribution on behalf of their employees as a benefit of employment. Please note that 10.5% is much less than the 18% average that employers currently pay. And then there is a footnote by Dr. Gerald Friedman analysis that you can click on there. The employer payroll contribution would be assessed quarterly. Let's see. Oh my goodness. Oh wow, that is a lot of numbers. Do I want to read all those numbers? Maybe. Oh my gosh. Let's see. Back under how do we pay for it? Let's go to the employee payroll deduction. Employers are assessed a payroll contribution and may choose to deduct a portion directly from employees' wages. This is the employee payroll deduction. After an exemption, the maximum amount employer can deduct is 2% of the employee's gross pay. The exemption is $15,000 gross pay times 0.25. The exemption phases out for pay above $60,000. The employee payroll deduction does not apply to employees 65 years or older. The payroll contribution would be assessed quarterly, and employers are responsible for its collection. Remember, the employer may choose to pay some or all of the payroll contribution as a benefit of employment. Let's see. And then there's a bunch of, there's a calculation examples there. Although there is a savings calculator. So on wholewashington.org, people can go to the savings calculator and, but that's not talking about the employee and employer deductions. So that's separate, but let's see, back under how do we pay for it? Self-employment contribution. Self-employment contribution. Sole proprietors will be assessed an annual contribution on their earnings. After an exemption, the self-employment contribution is 2% of adjusted net earnings. The exemption is $15,000 adjusted net earnings times 0.25. The exemption would not apply for net earnings above $60,000. Calculation example. Okay, back to how do we pay for it? Let's get to monthly premium. Everyone over the age of 19 in a household earning over 200% of the federal poverty line. So people that are earning over 200% of the federal poverty line will contribute a monthly premium if they enroll in the whole Washington Health Plan. The monthly premium will not exceed $200 a month per adult. The board defines the premium each year, and the board defines the premium each year and is required to reduce as much as possible. Our economist, Dr. Gerald Friedman, predicts the premium may eventually be eliminated. In the financial analysis for I-1600, that was in 2018 that we ran that initiative, he used a monthly premium amount of $134 per month, which is equal to current Medicare Part B premium. Employers may choose to pay all or part of the monthly premium as part of an employee's benefit package. If an employer does not cover the monthly premium, individuals will pay the amount directly, much like a monthly insurance payment. First, determine if your household is over 200% of the federal poverty line. So that would not really be very many people, would it? Okay, so let's see. I think I covered that. Let's read investment profit. Capital gains. All right, I'll just read it. Refer to section 301, 306 for tax-related definitions and exemptions in the full text of the bill for more details. After an exemption, see below, an 8.5% tax contribution will be assessed on net long-term capital gains. If the long-term capital gains is over $15,000, the tax will not apply to residential or home sales, agricultural income, retirement accounts. Exemption calculation, $15,000. I don't think I can. And then there's an example. I think this is not so easy to read aloud and make much sense. Let me skip on to something else. I think we know why we need universal health care. But I think this is an interesting list of bullet points to remember because we might all have our specific talking points. But these are going to be much more beneficial than healthcare as a human right, because remember, we have a lot of elected Democrats who say healthcare is a human right, and it's really overused and doesn't carry any weight anymore because people who aren't actually fighting for this are using that talking point all the time. And so, if anything, it almost. Yes, it is a human right, but yeah, so let's get to some of these because I think they could be far more useful for us. Why is universal health care the only viable solution? So we have some bullet points under several headings. The first one is better health. 1/3 of Americans don't complete doctor's orders due to cost concerns. Providers spend too much time doing paperwork related to coverage. Providers should decide what to do based on what is best for patient, not what will be covered. See, these are all really, really good so far. So that's why I'm going to hopefully listen to this and get some of this put into my head. People shouldn't have to worry about money when they are sick. Vision and dental are covered, critical elements of overall health. No networks. Every practitioner who sees patients in Washington participates in the plan. See the doctor you want. It's harder to heal from illness or injury if you fear high medical bills. That's very true. Now we have the heading of personal savings. No deductibles or copays. Current deductibles are too high and can easily wipe out hard-earned savings. Almost all prescriptions are covered with very little out-of-pocket cost. There will be a small copay with an annual per-person maximum of $250 per year only when brand-name drugs are used instead of generics for non-preventative conditions. Uninsured patients are driving up the costs of care for others. Costs should be predictable, controlled, and the same for everyone. The cost of current plans may vary based on age or medical condition of recipient or overall health of other people enrolled in plan. 90 to 95% of Washington residents are expected to pay less for their health care. That is that is a really important number that I just kind of breezed past. Just something really easy for me to memorize when, because I can tell people about the savings calculator, but that's automatically like a step that they're going to have to do. And hopefully most people go do that step. But just to say, 90 to 95% of Washington residents are expected to pay less for their health care. So in other words, most of us don't know any of the people who are going to pay more for their health care. You know what I mean? I mean, that's virtually everybody, or an extremely high percentage of people. So if people know and understand that, we should have no problem getting the signatures and the support that we need for this. All right, social justice and the greater good is the next subheading. Here we go. This is true, though overused and exploited by politicians. Healthcare is a human right. Healthcare is a human right. Representative Jayapal, please endorse whole Washington. We work very hard to organize and contact our representatives and share the word across the street to neighbors that we need to try and get Representative Kilmer on board. He's not coming aboard. He had a primary challenger, Rebecca Parson. I supported her campaign. She had a lot of progressive support. She wasn't able to push him towards supporting Medicare for all. So he's not moving on this issue. That doesn't mean that I give up trying, but it just means that we aren't passing, not via the normal channel, and especially when we couldn't get our progressive caucus to consider playing a strong hand, using leverage to force Medicare for all into the conversation and hold all of these people to an accountability as to who would vote, who needs a primary challenge. Make them say no. This is what Brianna Joy Gray was running her podcast. She had Ralph Nader on recently, and he was like, the idea is you want to get these people on the record saying no and no and no. And so this argument that people were using that we already know who's for it and who's not. We have a list of co-sponsors. Your average person doesn't know that. People down the street from me do not know, which representatives. Most people do not know that Representative Kilmer, for example, or Senator Patty Murray, Senator Cantwell. I went to Pierce County Democrats. This has been some time ago that I had a discussion when I was doing a fundraiser, brought some red berets and was going to donate some of the proceeds to Pierce County Democrats. Again, it's been a couple of years ago when I was trying to do some organizing in the local Democrats. And, I read Bernie's letter of thanks that he wrote to me and my fellow couple of it was just myself and one other crafter at that time who had sent a package of red berets to Senator Sanders' Vermont office. Anyway, I read the letter aloud during Good of the Order at reorg at the Pierce County Democrats, and there were audible gasps and clapping, even though a lot of people there, not a lot, but a fair amount, were our centrists, or Bernie wouldn't have been their candidate. But still, it's very exciting when you hear somebody local that's standing in front of you had something like a proper letter written and signed as a personal letter, not a form letter that a bunch of other people got, but an actual letter of gratitude from Bernie Sanders. That was something that was meaningful, like, because here I am with them standing there. So that was one of the the best moment that I've had organizing in a Democrat meeting was when I was wondering, should I share Bernie Sanders' letter? And my thought process was that was the most good that I was ever going to do in a single meeting, was to read such a good man's letter, what he sent to a local activist saying, I hope you, thank you for the work that you're doing, and I hope you continue to stay involved. And it just made me really, really happy to hear the response that I got. And it was reorg, so it was a room full of people. And I'm getting to my point with Senator Maureen Cantwell right here. So afterwards, I had gone back to our little Red Berets setup and booth, and a woman came up to me and was buying a red beret, and she was really excited about it. And she said, I never would have thought you were going to say Bernie Sanders. And I said, oh, really? And I said, who were you thinking it was from? And she said, well, I thought maybe Senator Cantwell or something. And so, naturally in my mind, I was thinking, I know that she's not for Medicare for all, but I wasn't rude to that lady, because it was a completely authentic, like, that woman just didn't know that Senator Cantwell is not for Medicare for all. So I just did the best in that moment to say, oh, I would be very happy to knit a red beret for Senator Cantwell, but first we would need her to, one, co-sponsor Bernie Sanders' Senate bill for Medicare for all, and ideally also to endorse whole Washington for universal health care for Washington state. I said I'd probably knit her a beret for either one of those actions, and ideally both. And she said, well, she's for Medicare for all, isn't she? And I said, no, she's not a co-sponsored. She said, oh, what? I'm not laughing. I'm truly, no, but this is the point, is that you have people who are even some people who are active within the Democratic Party who do mean well, but just literally don't follow. They only listen to the talking points, and they don't know who has co-sponsored what, who is for what. So I wish that I was back on the vanguard to kind of say, but I can't have forever on a podcast. But this is what occurs to me now on Force the Vote, is like, except they said, force the accountability and force the conversation, those two things. And I very strongly agree with both of those points that they made, for this very reason, that this talking point that some of the people that were attacking Force the Vote came up with was, we already know where they stand. What is the point in doing that? We already know who is for that. You're talking about a very, very small sliver of the population on Twitter, in very highly educated, like, who follow policy to the letter, to the detail, who actually know who are co-sponsors of Medicare for all. This is not your average person. This is not the person down the street. This is not the person in a local Democrat meeting. And so, yes, forcing that accountability would have shined a huge spotlight on all of the no's in the middle of a pandemic, because there are a lot of well-meaning people who actually really just believe that a lot of their elected Democrats support healthcare justice, because what they hear over and over again is healthcare is a human right. So that is, so I won't let Force the Vote go. I will continue to bring it up as time goes on, as these things occur to me, of why that was such a necessary strategy. And it doesn't mean that I haven't moved on, or we're not going to continue to press forward, but I'm letting people know that we shouldn't allow, I just don't understand what people are afraid of. Time is now to demand things from progressive, to demand things from everybody who is elected, they're paid. We pay them from our salaries, our tax dollars pay their salaries. So I'm getting myself worked up again here. But all right, so back to that. So that was all because I read healthcare as a human right. Yes, healthcare is a human right, and we do have a right and a responsibility to hold these people's feet to the fire and make them publicly tell us no, which is difficult in the time of COVID. That's another reason why an action like that, like Force the Vote, would have been so valuable to us. I would go down to my local town hall and to stand out in front of their offices, but our hands are tied a little bit in the time of COVID. We're not as active. We're not able to be safe, to organize in the same out publicly the way that we were. And we'll get back around to that hopefully, but I can think of so many reasons why it was a good strategy. So, all right. Profit doesn't belong in healthcare. That's absolutely 100. Profit does not belong in healthcare. Medical debt is the number one cause of bankruptcy and homelessness. So that's the issue that we have to keep bringing up whenever we see, for example, on social media where people are, I'm thinking of an individual who just shared his article, in a response on a thread that I did, and he was just wanting to share that he had written a local article about he and his mother and his family are living in a hotel in Florida, and his mother is a nursing assistant, and he takes whatever tourist jobs that he can get, and they are living out of a hotel. They're homeless. So anytime, and I know Rebecca Parson is working, one of the main issues that she has taken on now that her campaign is over, but she's continuing to organize, is housing for Tacoma, safe housing and homes. So I think that it's really important that we tie these issues together everywhere, whether it's out at an event or organizing on social media, is to say, when we see homeless things, to just go ahead and link Medicare for All into that by saying medical debt is the number one cause of bankruptcy and homelessness. Residents of Washington counties with poor access to healthcare have shorter life expectancy. Crowdfunding healthcare is immoral. Popularity and privilege should not determine who lives or who keeps their home. Inadequate access to mental health and addiction services is a public safety issue. I am 8 months in recovery right now. So that's very personal. It's a very personal thing to share. And it's a little bit, I don't know, I wonder sometimes, is that the right thing to do, to put it out there? But it's something that I struggled with for a really long time. And because my family has the VA, because my husband retired, I have the VA for life. And so I was able to get the quality care that I needed. I don't think people should have to join the military in order to be guaranteed health care for mental health or addiction services. So almost every other comparable country in the world uses this system and has better health outcomes that cost much less. Okay, that's true. Universal health care. Too many in Washington are uninsured, and anyone can be injured or diagnosed with something unexpected. That's very true. People end up in hospitals or die from conditions that could have been well controlled without any hospitalization if affordable health care were accessible to all. Then we have individual freedom and the pursuit of happiness. Your ability to be healthy should not depend on what kind of job you have. People should not stay in jobs they would otherwise leave to secure healthcare coverage. People should not stay in relationships to maintain access to health care. Artists and innovators shouldn't be held back by fear of losing benefits. Employers and people spend too much time trying to figure out which plan is best for them. So then we have fiscal sustainability. Whole Washington Health Trust will save an estimated $9 billion each year. See, I said $9 billion. I didn't say each year in the recent interview on the Vanguard. So yeah, $9 billion each year. And this was from Dr. Gerald Friedman's study, which it could potentially be even more now. Employers and people spend too much time trying to figure out which plan is best. I read that. The 8.5% payroll tax imposed is much less than what employers pay now to offer benefits. Companies might want to move or stay here, which could create jobs. Rising costs of healthcare are unsustainable and dragging down our economy. Insurance and financial processing jobs will be replaced by jobs created in the healthcare sector when more patients seek the care they need. That's a really, really excellent point that we need to say, because that's a really big talking point of the opposition, is that's going to destroy jobs and take away jobs. And actually, when you calculate in how many people aren't seeking care and how many more jobs that will actually create when everyone is able to get the care that they need, that's a really big point. In the current system, U.S. companies can't compete with foreign companies who don't have these high benefit costs in their bottom line. The money families save on healthcare can be reassigned to other segments of our state economy. Okay, so then it goes to volunteer form and things you can do right now. So if I'm curious, let me go to what you can do right now, because I'm going to see, like, again, to give an example, if somebody's not in Washington State who might be watching this. So the things, though, some of them are local actions. Let's see what we've got here. So we've got Senate Bill 5204. Call Senator Annette Cleveland's office. This is critically important. Without Senator Cleveland allowing a hearing, the bill will go nowhere. Please call Senator Cleveland to let her know you expect a hearing for SB 5204 and to let it out of her committee. Her direct number is 360-786-7696. 1 second. Call your state senator. The following senators have sponsored the bill, and then we have the list of senators that's there. I'm not going to read all of them, but if you are in Washington State and your senator is not on this list, mine is not on this list. I have called Senator Jeannie Darnell, but again, I can make that call, and I've actually requested a contact back, and I haven't received any yet, so I can call her again on Monday. If your senator is on the above list, okay, thank them. Yes, if your senator is not listed, please call them and let them know you're in favor of SB 5204. Any personal health care stories are helpful. Ask if the senator supports this bill. If not, please ask for any specific issues or questions. Then, if you have any feedback from the discussion, please email info@wholewashington.org. If you don't know who your state senator is, enter your address here on the district finder. You see everything is available on the website. They make it, there's nothing, as new volunteers, if people that watch this, there's absolutely nothing that, pretty much everything is found. Even if you're a new volunteer and you're like, where do I get started? Everything is here on the website for many, many actions that you can do without even attending our weekly volunteer meeting, which is on Monday nights at 7:00 via Zoom. So you will be informed, you'll be sent that Zoom link and told how you can, Graham? Okay. So now we have, and then the other thing you can do is comment on the bill. Let's see. Yeah, go to the SB 5204 page, and there's a link that sends you right to it, and then click comment on the bill. Fill in your address, send in all 3 of your elected officials, include your personal story, best argument, or brief statement in the comments section. This is really important. I've done this. We've asked everybody in Washington State to please do this. The more comments that are on the bill, the better. Okay, the next thing though, this would be not necessarily solely relevant to Washington residents. Donate, especially monthly. So then they do say, campaigns say that a small recurring donation is better than a one-off. So, because it's something that whole Washington can automatically figure into their budget. So even if you think, well, I just don't have a lot to give, you could have a recurring donation of $5 a month. Or $2 a month. That would be really valuable to whole Washington. That's postage. That's helping to print petitions. That's okay. And also on that note, we are going to be having an online auction pretty soon. And I'm not sure, Georgia was just going to do it for Georgia Davenport, our field director, was going to do it for just a one or a couple of days, but I'm hopefully convincing her to extend it out so that we might hopefully, well, that's on a whole different tangent. But my point is, if you just sign up for the email, you'll be informed about the auction and everything. And there might, we're knitting these Bernie's mittens, and there might be, some fun items for you to bid on. Or if you were an artist anywhere in the United States, you'd kind of have to hurry on this, but you could obviously mail and donate something, Medicare for just anything. It does, they're just taking auction items. If you have something cool that you would like to donate that you think people would bid or pay some good money for, you can donate auction items. Okay. Buying whole Washington merch. Yep. And then subscribe is the best way to hear about updates, actions, and events. So there are plenty of places though on this website that you'll probably, I think, be given an opportunity to subscribe. Now let's see. We covered how do we pay for it pretty well, why we need universal health care. Here's how we get there. How's everybody, the one person that's watching, doing? If you have a question, something you want for me to navigate on this website, feel free to ask me in the comments. All right. The roadmap. Whole Washington is committed to passing universal health care, and we support all efforts to achieve a single-payer system. We're fighting at the local, state, and national level, but on this campaign, we'll focus on the state-based campaign. We're pushing for the whole Washington Health Trust using both the ballot initiative process and the Washington State Legislature simultaneously. So see, for the next interview, if I get invited again anywhere, I will have the roadmap, this first paragraph, memorized. Let me read it again. Whole Washington is committed to passing universal health care, and we support all efforts to achieve a single-payer system. We're fighting at the local, state, and national level, but on this page, we'll focus on the state-based, so I wouldn't say that part, but I would just skip to, we're pushing for the whole Washington Health Trust using both the ballot initiative process and the Washington State Legislature simultaneously. So you will often see me on Twitter saying, a both and approach, or an all good efforts. That's why I'm knitting these, and that's why people are crocheting, because we know people can't afford to wait. So when Representative Pramila Jayapal resubmits that bill, anytime that there is an increase in the national conversation or an opportunity to support somebody like Senator Nina Turner, who is a champion for Medicare for all, and particularly when she makes any tweets or comments or shares an interview where Medicare for all is talked about, for example, I am going to boost and support that, and whole Washington is the same. They actually were one of the few orgs that attended the national first hearings, the historic hearing for Medicare for all in Washington, D.C. So anytime there's a national push or a national effort, whole Washington volunteers step right up to, we have the email, the volunteer list, we can send out calls to action. This is why, as a strategy and as a grassroots campaign that has a solid bill with all the funding in the legislature and a ballot attempt that will be underway again, I am starting to feel like I'm going to put out there very strongly that we do not deserve to be ignored and marginalized and not included in the national strategy conversation, because we currently, as you all know, have a president who said that he would veto Medicare for all. We have a largely, overwhelmingly corrupted Congress on both sides of the aisle. It is therefore that if someone does use the talking point, healthcare is a human right, those people should be standing in solidarity with all good efforts. That's what we do as grassroots organizers. We step up to the plate, and every time there is an opportunity or an action, such as, reintroducing Pramila Jayapal's Medicare for All, a national hearing, Bernie doing a town hall on Medicare for All, calling our representatives and senators, force the vote, National Healthcare for All conference. We are in there stepping in on all of these actions. So increasingly, and just right now, I'm saying we need this kind of solidarity turned back in our favor, because we are the activists that are making this happen. We are organizing at the local level. So it's just not on, as they would say in the UK, for our efforts to continue to be ignored by Medicare for All champions. It's not okay. It's not okay with me. And, I said the other night on the interview, and a good nurse organizer, a friend of mine, who is a former board member of Whole Washington, and she's still an active volunteer of Whole Washington. She made the meme because I said, why can't we get Pramila Jayapal's endorsement for Whole Washington? And she memed it and she put my little mouth bubble there. And then the looks that Zach and Gavin were making were absolutely hilarious, because it's it's a fair point. It is a fair point. And just so you all know, we've been asking for her endorsement and attending her events, clear back during 2018 ballot initiative 1600. She did a press release or a press event up behind Pike Place Market, and there were probably roughly, I don't know if I want to say 100, maybe not that many people, but I'm going to say about a third of the people that had shown up to that event were all wearing bright red Whole Washington t-shirts, and many of them were in red berets. And we had our please sign my petition, please sign initiative 1600 to get universal health care to the ballot. I was personally asked by a staff member to lower my petition and keep it out of the angle of the camera, because they didn't want initiative 1600 to be on her press release. And while I understand that that was about a bill that she was working on or introducing, and so that was like out of supposed respect for what it was that she was doing, that she solely wanted to focus on, many of the people showing up there were her very own constituents. And so we hung around until after the event, asked her to endorse Whole Washington, asked her, could she sign the petition? And she was just sort of kept, we were sort of barricaded away and not really able to ask her this question directly. And I was really shocked later to see on the news that out of all the different camera angles, and there were a lot of us there, they didn't capture like a Whole Washington t-shirt or a petition board. They were very successful in keeping the cameras to where you wouldn't even know we were there at that event. So when people wanted to know what did I mean by gatekeepers, there was a tweet where I said something and Ryan Knight retweeted it. And I said something about I said there's going to be a food fight within the Medicare for All community. In fact, it's already going on. And then I said, please don't side with gatekeepers, whether wittingly or unwittingly. They are harming the movement. And, I did have a couple of comments back because it is a bit of a cryptic tweet, right? And so I think that it might shock people. And I'm not here to smear our progressive representatives or Representative Jayapal. That is always going to be down in my memory banks as that was not okay. That was just deeply disrespectful. That was deeply disrespectful, and I will share that. And that may not be popular, but I just think that a lot of progressives would be really shocked if they understood how long that whole Washington has been organizing barnstorms for National Nurses United and working in solidarity and making these barnstorms, by the way, that we hosted 10 or 11 different barnstorms. And those were all in service to bringing people in and getting them to support and ask for co-sponsorship when Pramila Jayapal introduced HR 1384. And so that's all of the solidarity. And we've been asking this entire time, clear back since we ran Initiative 1600, for her endorsement. And because her endorsement would move mountains for Initiative 1600, for SB 5204. If she were to make a tweet or, make a press statement that she was, that while she is going to continue to fight for national improved Medicare for all, and she'll be introducing the House bill, reintroducing it here very shortly. She is also going to endorse whole Washington and wish us the best for passing that bill, or at least getting a public hearing for SB 5204, and with whatever initiative attempts that we do. That would, as you all can imagine, whoever ends up seeing this, and thank you, one person who is watching, that would absolutely seismically change the game for us. And I don't think I need to go into explaining how and why. But the thing about it is that they being Bernie, being Pramila Jayapal, being national, the whole sort of progressive national establishment have decided that they have their plan for national improved Medicare for all, and they're not going to support one-payer states as part of a national strategy. And so we've essentially played respectfully and nice. I'm not going to turn around and try to undermine good legislation. Or, of course, I support Representative Pramila Jayapal's bill. Of course, I will call my representative and ask my neighbors to call Representative Kilmer. We've been doing that. We've been doing that ever since I was introduced to whole Washington, and that was in the fall of 2017. She knows who we are. They all know who we are. And so I'm just at this point where I'm like, we have a real bill. We have a real chance to pass universal health care in Washington state. It's fully funded. And just like with the federal legislation, she knows her bill isn't going to pass the House. It's not going to pass, not with this makeup. That doesn't mean you don't fight for it. She's going to introduce it, and everybody is going to push as hard as they can. That's what we do. We put our agenda. It doesn't matter when it was Trump, we were fighting for it. That's the thing with whole Washington. We never said, as a matter of fact, whole Washington was founded because Bernie Sanders, when it turned out he wasn't going to get the 2016 nomination, a couple of people, Georgia Davenport and one or two others, said, how do we do this? What are we going to do? Let's learn about the initiative, because Georgia had worked on 735, I think it is. I think it was, to get money out of politics. So they set about okay, let's figure out how to set up a nonprofit, how to set up the whole Washington Health Trust, and then let's just start forming this grassroots organization, because we're not going to wait. We're not going to wait on, the fact that we're going to either have Hillary or Donald Trump. So that started before we even had Donald Trump. And then we have continued to organize all throughout the Trump administration. And then we did a hell of a lot of organizing along with Washington Bernie Kratz Coalition, which is our Washington State official, our revolution chapter, organizing for Senator Bernie Sanders for his 2020 bid, along with local candidates and everything else. So, they know who we are, and we have a real chance to pass it here in Washington State. And if we had some national support, we could at least, as I was going to say, we understand that we're not going to pass it through our state Senate right now. But that we understand that. We're crystal clear about that. We know we have to run an initiative. But we could get a hearing. That's what all these local, the papers that we're doing, we could get a hearing. We deserve a Senate hearing. And Representative Pramila Jayapal, just in making an endorsement, we could get a hearing that way. So, if you see this and you make it this far into this long live stream, please ask. Please ask. Leftists needs to stop being afraid to ask, afraid to, I guess I'm not ever going to work on, I'm not running for office. At least that's not what I'm going to plan my life around. People need health care. So if it's going to make me, unpopular or untenable, or maybe I can't work on a particular campaign because I asked too much of an elected progressive, sod that. I don't care about that. That's not what I'm doing here. I am a knitter of berets, a craftivist, a board member of Whole Washington, and we've been organizing for this shit. It's absolutely shameful that more people don't understand how a one-payer state strategy can work, and it's because there are gatekeepers. Now, I have no doubt that they're well-intentioned gatekeepers. They think the best way to do it. And actually, we're not even arguing that the best way to do it is to pass the federal legislation. Everybody is on board with that. Georgia Davenport and many other members and board members of Whole Washington understand that the federal legislation is the ideal pathway. But we are in the middle of a pandemic, and we couldn't get force the vote. And we have a president who said he would veto Medicare for all. So now we're at a point in time where what is the next thing that we're going to do? Wait and see if we can get a good progressive challenger who dares to stand up to the establishment when we know that Kamala Harris is going to be absolutely the assumed thing. 2024 is the best case scenario, and you damn well better be guaranteed that I'll be helping whoever it is. I hope it's Senator Nina Turner, Congresswoman Nina Turner. But we're not going to sit around and wait for that to happen. As depressing as it is, that is years away. And we need every single action and every single day leading us up to that point. What do these national movement leaders think they're going to need in order to eventually pass this legislation? They need the kind of ground game that Whole Washington is building. They need that movement solidarity and grassroots building. They need me to go down the street asking my neighbors if they will support getting universal health care to the ballot. And by the way, please call Representative Kilmer and ask him to co-sponsor Medicare for all. You see how that works? It's really taking volunteers like me, activists, it's taking us for granted to expect us to do years worth of work on an issue and turn around and say that you're not going to show us any solidarity when we're doing the work. You need us. We are fighting for the same thing. We are fighting for healthcare justice. Okay, so that is just about that. I think that's enough for me to go back and listen to. Maybe that I'll just make this my live feed every day. Bernie, Representative Jayapal, please endorse whole Washington. I know you think that you have a plan. People can't afford to wait on your plan. We can't afford to wait on Joe Biden. I think it's absolutely a travesty that I can say that I can go and get treatment. My treatment was essentially covered. I had a few out-of-pocket expenses. Mental health is a human right. Some substance abuse treatment is a human right. Dental is a human right. And human right means that you are doing everything that you can to get people covered. And ignoring, hoping that will go away, or I don't know what the hope is. I know we're not convenient. I know we don't fit into the national strategy plan. But I'm really, really confused as to, if you say you're going to fight for something, then when there is an organization of people that have spent years building an organization and there is a good bill that could be receiving a hearing, where's the solidarity? And I'm deadly serious about this. I'm tired of, I'm not going to continue to be quiet about it. I have a YouTube channel now, and there might only be one person watching it, but I will make 100 videos. I will sit and read whole Washington's text over and over again. And I'll share the videos on social media. And I'll knit more of these red berets. I've knit over 300 by now. It's time for some solidarity because people they've lost hope, I'll be honest. Like, there's a few of us hanging on saying, don't lose hope. This could give us hope. Even people who don't live in Washington State, if they saw the solidarity and saw, oh my God, Washington State has a chance to pass this and the movement is getting behind it, they would feel hope again. They would feel like, oh my God, how are they doing it? We can do this. That is what's happening. We have other one-payer states and they are doing their actions and they're working on it. And so if you are in a state and you want to know how you can work on it, you very much can be part of the whole Washington you go to onepayerstates.org and that's what they're doing, providing a template. And this needs to be talked about. The information needs to be gotten out there to people by people like AOC and Rep. Jayapal and Bernie. They need to be saying, I hope you're all running for office under whatever party that you're running for. Oh, and another action you can take if you still believe in fighting for Medicare for all is you can go to onepayerstates.org and you can see if within your own state there is an effort and get plugged into that organization and start doing the groundwork. That's what we're going to need in order to pass it. Because remember, we have precedent for this. This is how Canada passed. Their Medicare for all system was province by province, beginning with Saskatchewan. And that was over 50 years ago. I don't know if it's 52 or 53 years ago by now. So it's absolutely, I guess, appalling. It's beginning to border on appalling. I love and follow Warren Gunnels. I deeply respect Bernie. I have nothing but respect, but I'm at the point where I've begged enough. We wrote an entire song. We wrote a song thanking Bernie. I know he heard it because I shared prolifically. It was so many people went into that, a whole bunch of people on the screen singing Red Berets for Medicare, Medicare for all. Healthcare is a human right. Healthcare for everyone. No one is left out. No one is left behind. I sang in that. There were about 20 16 or 20 of us. I don't remember, but it was Seattle Peace Choir. And that all came about because of an activist on Twitter had seen, and that was Pete the Burner, not Pat the Burner, Pete the Burner. He had seen me say, I need help with this. Who else can crochet or knit? He taught himself how to crochet, and then he tagged me singing a cappella. He had changed the lyrics to that classic, Croce delizia, croce a red beret. You know, it's so he wrote that, and then we got the idea to Doug Balcom, who is the lead conductor and of the Seattle Peace Choir. He did a YouTube tutorial video, a warm-up video, and a tutorial and a musical score. It has a musical score. He wrote a musical score. And he emailed all of those things out to those people who whole Washington had sent a thing out saying, we're going to do this song. If you are musical and you want to participate, here, get this video, here are the instructions. Get yourself singing and turn in your video to Doug Balcom. So that many of us put on red berets. We practiced and recorded, and then we sent our videos to Doug, and he musically mixed everything to where we all came together sounding pretty decent, considering we were all separate in our own homes recording. And then to top all of that off, Jeff at Spitting Back on Twitter turned that final video. He added some cool things to it, a couple of graphics like, Canada passing it one province at a time, and a couple of other things, and chief of receipts. My point is that I'm past the point, I've been really careful not to alienate and to, a person wants to be loved by the Bernie movement and the Bernie establishment. But what I love is I love whole Washington. I love the people that have organized for this every day. And it doesn't matter if we have a national candidate who, as they said on the Vanguard the other night, it doesn't matter if we have a candidate repping our values or not. We rep our values. We rep our values every single day. We did it all throughout the Trump administration. We're doing it through the Biden administration, and we're doing it until we pass Medicare for all. And it hurts. It really deeply hurts. They know who we are. They know the efforts that we've put into this, and we are being virtually ignored. I don't think that's acceptable. I'm no longer okay with it. Okay, I gotta go. I'm gonna just get a little bit too emotional. We keep working, we might not ever get their endorsement. Nothing's going to stop this movement from happening. We aren't going to be naysayed and cowed by fear. This is my final thoughts here. Because in the Healthcare for All Now conference, the ballot initiative got a bad rap, and all the historically the things that had gone wrong with ballot initiatives on a PowerPoint were highlighted on a PowerPoint. Not any of the positives. I have almost nothing but good things to say about a ballot initiative. I have almost nothing good to say about legislative efforts. The only reason, I'll speak only for myself, but I don't think that any of the board had, much of any of the Board of Whole Washington. Nobody thought we were going to pass. No, we're not naive. We're experienced single payer activists, and we've been involved in the political system. We've run for office. We've supported people who have run for office. We understand, that the Congress is bought, but we needed a hearing. We still need a hearing. Thank you for listening.